The global death toll from the coronavirus continues to surge, and with millions out of work in the United States, President Trump is issuing new guidelines to get the country moving again. Hello, I'm Arnold Monto, and this is The Heat. The COVID-19 pandemic is driving a wave of fear across the globe, with over 2.1 million cases now recorded and more than 142,000 people dead. Here in the United States, where some 22 million workers have sought unemployment benefits after a month of shutdowns, President Trump is outlining steps to get America working again. Meanwhile, in the United Kingdom, more than 13,000 people have died from the virus. We will talk about the situation there in the United Kingdom later in the show, but we begin with CGTN correspondent Nathan King, who joins us from the White House. And
Hi.
Nathan, the president is holding his daily news conferences on the coronavirus pandemic. Of course, these news conferences are very important, but today's is especially significant because the administration is unveiling its plans to get the economy reopened. So what have we learned so far?
Yes, it's called Opening Up America Again. Sounds a bit like Make America Great Again, doesn't it? But it's actually very different from the US president's first plan. Remember when he wanted to open up the US economy in its entirety March 12th, then April 12th, rather, Easter, then May 1st. Well, this is a much more gradual approach, essentially a three-phase approach. But before you even hit phase one, essentially, they want 2 weeks of showing no reduction in COVID cases and reduction in flu-like cases as well, because there isn't enough testing, so one could be the other. Also, to make sure the hospital capacity in each state can deal with COVID and other cases as well. And also testing, not for everyone, but frontline healthcare workers as well. And then there's essentially three phases. Phase one, schools remain closed, essentially much like we have now, but some people going back to work with a lot of social distancing, masks, etc. Let's listen to the president.
We are not opening all at once, but one careful step at a time. And some states will be able to open up sooner than others. Now that we have passed the peak in new cases, we're starting our life again. We're starting rejuvenation of our economy again in a safe and structured and very responsible fashion.
Now, there's no timeline on these three phases. In fact, the US president just said that some states could meet the criteria within a couple of weeks. That hits his May 1st deadline. Maybe 8 or 9 states that are showing no new cases or not significant amount of cases. And in fact, Dr. Deborah Birx, who is on the coronavirus task force, says that the timeline is really up to different states, which is going to be very interesting to see how that works. The real thing here is that the president just 3 days ago said, "I alone call the shots." You remember that? He said that in the room behind me and in the Rose Garden. Now he's saying that the governors call the shots, essentially, on their own states. And what has to be defined yet is they say the federal government will be standing next to you, but will that mean that they fund testing, continue to fund, for example, more medical equipment? Will it also fund protective equipment as well? All these questions remain unanswered.
Okay, thanks. Nathan will stay with us, but also joining us now from Toronto via Skype is Dr. Rima Styra. She is an associate professor of psychiatry at the University of Toronto who has studied SARS and the psychological effects of quarantines. Also joining us via Skype from Michigan is Dr. Arnold Monto. He is a professor of epidemiology at the University of Michigan's School of Public Health. Thanks to everyone for being with us. Arnold Monto, let me start with you. What do you make of the White House three-phase plan to reopen the country? And as Nathan just told us, the main provisions of phase one will be to continue to telework, schools remain closed, gatherings no larger than 10, and non-essential travel must be minimized.
I think it's a sensible program. It's quite different from what we heard a few days ago, where everything was supposed to open with a bang on May the 1st. I think this is a reasonable program. The only question is, if we're going to be using testing as guidance, do we have enough tests?
So what would you be looking for? What would have to be fulfilled for this plan to work?
Well, we were going to be able to identify any new cases of COVID infection, and we're going to need tests for that. And then we're going to have to respond to it because the virus hasn't stopped circulating. We're going to continue to have to identify cases and contain them in order for things not to return.
Rima, what do you make of the plan? And I'm thinking especially of the fact that now there is a plan in place. People can see possibly an end in sight.
Mm-hmm. I think there's going to be an air of optimism in terms of moving forwards given the plan. But I think we have to be very aware of the fact that a lot of people have been in quarantine or self-isolation or social distancing for some time, and it's had an effect on their psyche as well. So when we looked at our population, we did a study during SARS on quarantine. We found, and that was a very short time period. We were actually in quarantine for about an average of 10 days. People developed symptoms of post-traumatic stress and depression. And at this point, COVID-19 has been a much larger outbreak with a lot more serious consequences. So lots of individuals who now have had economic losses, but also a lot of deaths throughout the country. So I think what we're going to see is as we get back to a more stable normal, we're going to have high levels of anxiety. Especially people are going to be hypervigilant, which is one of the symptoms of post-traumatic stress symptoms as well. So if somebody coughs, they're going to be more likely to become anxious, worried. They're going to be a little bit more fearful about the future. There's going to be a lot of grief also in the country because we have lost so many people. There's also going to be some survivor guilt. I think we're going to be dealing with a lot of mental health issues, and I think it's wonderful that people are realizing that this is an issue, and they're moving forwards and stepping up and providing care for these people.
Arnold Monto, the guidelines have these 14-day benchmarks built into them, which will be left, I guess, up to the governors of each state to ascertain whether those benchmarks have been met, and then they can move into the next phase. And it might not be the same throughout the state. It might be different in some areas than others. So what are the risks of this plan?
Well, there are risks whenever you open the economy and the virus is still present. I think the risks as described are going to be manageable as long as we can identify if we are having transmission and many outbreaks. I think another thing that has been really good, given the fact that this has been devolved to the states appropriately, is that there are now consortia on the West Coast, on the East Coast, and now in the Midwest of states getting together to try to harmonize their plans, which is going to be very useful because people work across state lines. And if you have one state that's doing one thing and another state that's doing the opposite, that wouldn't work. So now we have some sensible approaches, and we need them because the economy has to recover, because if we don't have the economy to recover, we're not going to be able to afford to do any of the appropriate measures to take care of people who have long-term symptoms.
Nathan, we heard the president tell us that this is not about liberals or conservatives or Republicans or Democrats. This is about the United States. But I'm wondering to what extent this could fall out along political lines when we have Republican governors who may be a little bit more eager to get back to normal than others.
You mean Florida, don't you? Yeah, Governor Rick DeSantis is going to be very happy with this because it does give him a lot of flexibility. The problem is, and this is what Dr. Anthony Fauci just said, we may see a resurgence in cases. And the last thing you want to do as a governor is encourage people to go back to work and start using beaches and going to theme parks and suddenly see a resurgence in cases, because that's going to be very, very negative when you have to shut everyone down again. So I think even though people will be eager to open up, there will be this fear that your voters essentially could turn against you. The thing about Republican states, and there are about 8 or 9 that haven't really put down strict measures, because let's face it, a lot of them are rural, they don't have a lot of cases, and people are spread out. They are going to come back very quickly. But however, let's face it, where are their markets? they're New York, they're California. A lot of this is going to be dictated to how the economy comes back. And I think the US president obviously wants to see a V-shaped recovery. Let's face it, the economy was one of his unique selling points when it comes to November's election. And he really wants to see the economy turn around that quickly. But the thing is, he's not in charge, these guidelines aren't in charge, the governor's not in charge, the virus is essentially in charge. And the timing, of course, could change without a vaccine or therapeutics or drugs that mitigate this. It could come back in the fall. So I think everyone's going to be extremely wary, state by state by state, on how this happens. What you may see is a little bit of frustration from here on which governors he thinks are going quick enough or slow enough, and I can imagine politics will come back into play there.
Rima, you talked about the psychological impact that coronavirus will have on people who've been infected, people who've been looking after them. And I'm wondering, is it too early, or is it the right time for us to actually start talking about these things, the mental impact?
I think the earlier we start talking about the mental health impact, the better, basically. We need to identify these symptoms early on. We need to be as preventative and as helpful as we can be. We need to be proactive. We already know that healthcare workers are extremely stressed as it is. There's been a lack of PPE. There's concerns about their own health. There's concerns about taking the virus back to their families and the guilt that would occur if family members were actually infected. And their need to basically to take care of patients, to be active in their profession and do the things that they've always wanted to do, is take care of patients. So that's one group that's going to be highly affected. And the population in general, we have a large number of very vulnerable groups. For example, we've got the elderly who are a lot more isolated. They themselves are aware of the fact that they're higher risk in terms of getting COVID-19. And they often don't have maybe the technology to reach out as easily as younger individuals, and also individuals who might have had mental health issues previously.
Right.
They might have been a little bit more separated now from their healthcare workers. They might not have been able to get in contact with their counselors. Right. That would be another vulnerable group that we would really want to address very quickly and very early.
Okay, let me go very quickly to Arnold. Arnold, I've only got about 30 seconds left, but we hear a lot of discussion about contact tracing. How does that fit into this plan, these guidelines that we've heard from the White House?
That is an essential part of the plan, because we know that we are going to see individuals who develop infection. And if they develop infection, then we're going to have to go back to the way we tried to contain the outbreak at the start, and that is identify who their contacts are and put them under quarantine for at least 7 to 10 days, best 14 days.
Okay, and we have to leave this part of the show right here. Thank you to all of you for joining us. We turn now to the United Kingdom and its battle with the coronavirus pandemic. Earlier, I talked with journalist and commentator Mark Seddon and Dr. Mohammed Munir, a virologist and lecturer at Lancaster University. Mark Seddon, Dr. Mohammed Munir, thanks so much for joining us. Mark, let me start with you. The number of reported cases in the United Kingdom is now more than 100,000, and the official death toll is over 13,000. The Foreign Minister, Dominic Raab, said on Thursday that the country is at a, quote, delicate and dangerous stage in the pandemic. In fact, the government has extended the lockdown in the United Kingdom. What does it look like to you right now, Mark?
Well, I mean, those are the official figures from hospitals. Not included are the numbers of people who may have passed away in care homes and also in the community, i.e. at home. So that figure is probably lower than the real figure. I mean, the government is also saying that the number of infections is plateauing, and there will be an increasing number of people possibly in these mortality rates over the next few days. But it's still very, very serious. The government is being challenged by the official opposition to give at least some indication of an exit strategy, of what that might mean, because obviously we're beginning to see in parts of Europe that there is an exit strategy of sorts beginning to take place there. But, you know, Britain was somewhat later into the lockdowns than its European neighbours. And there's been, a degree of criticism of the government from some health professionals, some scientists about the strategy it's followed, which some have been saying has been slow and erratic.
Dr. Munir, why does the United Kingdom have such a high death toll, and is the country's National Health Service able to cope with what's going on?
I think if we look onto the whole scenario of COVID-19, early preparedness and the timely actions, those being decisive factors for the overall severity of the disease in any country. For example, if we take an example of Germany, they have been very good in ramping up their diagnostic capabilities in the beginning, and therefore they were able to identify people who were otherwise contamination source for vulnerable communities. But if we look on to the same context into the UK, I think the actions those were taken, those were too little, too late, especially for first 3 weeks, when the disease started to appear. And basically, we all knew here that the disease is coming. China gave us 1 month, and then the other European countries, they gave 1 month. So overall preparedness has been really lackadaisical, and that is really the major reason that the overall capability within the healthcare system was not expanded. It's only last 3 weeks when the lockdown started. That was the time even the procurement for PPE were started to be made. And the same case was increasing the critical care in Nightingale and other facilities. Those were considered. And also this figure, as Mark has indicated, is not really the true picture. Probably the overall mortality is really higher than what is in the figures now.
Mark, here in the United States, there's been a lot of criticism in the rollout of things like test kits and the provision of ventilators for people who've been stricken with the virus. Is that a similar situation in the United Kingdom?
Well, don't forget, in Britain, there's been 10 years of austerity, and there's been criticism that the National Health Service wasn't adequately prepared for something like this. Of course, the government and its defenders would say, well, look, did we really know that a pandemic would hit as quickly and as hard as this one has? There has also been planning in the past, the 2016 plan, preparing for a pandemic like this. At the time, there was a concern that there possibly weren't enough ventilators. Look, at the end of the day, I'm neither a scientist nor am I a medical expert. I can only judge on the basis of what I read and who I talk to and all the rest of it. But my partner works in the health service, and certainly her local hospital wasn't prepared. The equipment wasn't there, and patients have still been coming in up until recently from hospitals back into care homes without being tested. And actually, this goes back. You don't really have to be an expert necessarily to comprehend that the advice from the World Health Organization, it's global advice, it is test and isolate, test and isolate. The British government began by doing that, but then sometime in March appeared to move away from all of this, believing in the advice it was then following from scientists that this idea of herd immunity could be built up, which is much the same as appears to have been the case in the United States as well.
Dr. Munir, what about testing and tracing? What has been done and what needs to be done?
What has been done so far is that people who are severely sick, they are hospitalized, and these are the ones who are tested. The tests are not available for the general public or the one who needs them. It's only been yesterday when it was announced that people in the healthcare settings or also healthcare, they are the one who will also be tested for COVID-19. So I think the overall scale of the testing has been pretty low right from the beginning. And although the government has targeted 100,000 tests a day, but we are nowhere near that yet. So I think that one of the major factors that led this virus to disseminate into the community so effectively and silently has been the lack of tests right from the beginning. And that's not really down to the 1 week or 2 weeks preparation. That is years of efforts because the countries who have been very good in deploying the test capabilities, those are having very good local manufacturing capabilities and overall industrial scaling up. So for the UK, procurement was late, and therefore the overall testing is low. And at the moment, although the government has been claiming that the number of tests they are having, they are more than the capacity of the need, because the need they already narrowed down for only healthcare worker and now the carer at the home. So therefore, the overall testing capability is low and certainly need room to be improved.
Mark, the Prime Minister, Boris Johnson, he's recovering from the coronavirus. How's that going? And is he involved in any way in the government's response to the outbreak?
Well, I mean, the last we saw, he was he left the hospital, St Thomas's Hospital in London, and he returned to the Prime Minister's country residence, which is not very far from where I'm sitting, actually, Chequers in Buckinghamshire. We understand that he's recovering there. But you see, all of the experts have told us that if you have been quite seriously ill with COVID-19, and it would appear that the Prime Minister was, it can take some time to recover. So deputising for him still is the Foreign Secretary, Dominic Raab. There's a daily press conference with him and with the Chief Medical Officer of England and other scientific officers. There's no doubt that the government machine is running effectively, but the chief is still absent. There is nobody absolutely at the helm. There's no prime minister running the country. And I mean, it is just worth noting in passing that so far Britain alone is the only country that really has had its political leader affected and effectively felled for a while by this virus. And in a way, it almost symbolizes for some the slightly slow and erratic response that both of us have been referring to. Now, that's not to say that there haven't been great success points. You know, we have these hospitals that have been built in a very, very short period of time. Many of the behavioral scientists who were very concerned that the British people wouldn't really observe lockdown have been disproved, because 90-odd% of people are. And, you know, it is the case now that there is a lot more equipment. But as the doctor was just saying to you, you know, the government has made a promise, a commitment for 100,000 tests to be taking place by the end of the month. And really, from where we are now, it looks as though it's going to be quite difficult to achieve that. And yet, of course, you know, a country such as Germany has been. So Britain is behind the curve in more ways than one.
Dr. Munir, what can you tell us about efforts in the United Kingdom to use some kind of treatment or even to find a vaccine?
Yeah, I think this is a really important question. Again, today seems like a day of criticism, really, that if we talk about, you know, the availability of any therapeutics or vaccine, there isn't anything that is recommended and need to be put into the market. The one thing that became very apparent right from the beginning is the convalescent sera. So the sera that is recovered from the patient who have already contracted the infection and successfully recovered from that. So we have been in the scientific community been highlighting that thing as interim measures to really use that anti-sera to immunize not only the frontline health worker, but also people who are really vulnerable and could go into critical situations. But government hasn't been in the situation to try even to use that one on a local trial, so that they have the infrastructure in place to deploy that. It's only been recently when government has started a small-scale trial in Glasgow to see if the convalescent sera can be used for therapy. Beside that, I think in the UK, we are moving quite well ahead of the curve in terms of developing vaccine. We have two groups, one in Imperial and Oxford. They are moving on very well. My vaccine is reaching to the animals, so just 2 weeks behind those two groups. So overall, vaccine effort has been really ramped up, and we are looking forward for having fruitful outcome in due course.
Mark, the country's monarch, Queen Elizabeth, recently addressed the country. Let's listen to part of what she had to say.
Together we are tackling this disease, and I want to reassure you that if we remain united and resolute, then we will overcome it. I hope in the years to come, everyone will be able to take pride in how they responded to this challenge. And those who come after us will say the Britons of this generation were as strong as any.
So, Mark, can you give us a sense of how the British are holding up, you know, especially with these restrictions in place, social distancing and staying at home?
Well, as we were just saying a moment ago, despite some of the fears of some, the vast majority of people are doing that, just that. Over 90%, we are told. It's very interesting that crime levels, certain crimes are decreasing quite rapidly, burglary amongst them. Of course, there are problems with domestic violence at home. Unfortunately, there's been an increase in that. But you know, that message you just played, the little excerpt from the Queen, I mean, it went down very well with the British public. There's no doubt about that. And actually, the British public seemed to be quite forgiving too of the government. It's enjoying quite a lot of support. People seem to think it's doing the right thing, even if they also think that it's been a bit slow and a bit erratic. But you know, at the end of the day, you know, the Britain is still quite fortunate in that it has a national health service, a form of social insurance that does not exist, for instance, in the United States of America, where there really isn't a healthcare system. There's healthcare, but there's not a system. And therefore, despite the deficiencies that we've also talked about, the austerity cuts in the NHS and the problems that there have been with equipment, there is this national effort behind a publicly funded health service. And that's very much, I mean, different types of health services and health systems exist in most of other countries too. But the United States system is a particularly one that's going to find it very, very difficult to cope, and that's showing.
Mark Seddon, Dr. Mohammed Munir, thanks to both of you for joining us.
Thank you, Anand.
And that is all we have time for on this edition of The Heat. Thanks for being with us and stay safe.
CGTN, covering coronavirus. From Asia, Africa, Europe, and America. The dangers, the uncertainty, a global effort to stop the spread and save lives. For the latest updates on coronavirus, stay with CGTN. See the difference.
Hello everybody, I'm Arnold Monto. If you enjoy the thoughtful, engaged discussions you see on The Heat, you may also want to subscribe to our podcast. It's appropriately titled The Heat. Twice a week we take a deep dive on world headlines, talking to experts, journalists and others. It's a fresh, focused and intimate look at the issues that matter most. Whether you're at home or on the go, you can find The Heat podcast just about anywhere podcasts are found. Have a listen today and subscribe. Thanks.